Yesterday, Governor Kemp told us that he believes coronavirus was spreading in Georgia weeks before the first case was officially confirmed. Joe Hankey has been looking more into that and has more on that timeline.
People already had this disease over a month ago in our state. There's some, and I'm one of them, that believes this virus has been here since potentially December or early January.
Governor Kemp made that statement Wednesday in a one-on-one interview with 11 Alive. Today, his office confirmed his statement is based on the unavailability of testing early on as the virus spread, meaning COVID-19 could have been in Georgia for weeks while going undetected. Today, we asked the CDC about when the virus may have first entered Georgia or the U.S. A spokesman wrote by email, it's not clear when COVID-19 first entered the U.S. CDC and others are conducting studies that may help to answer this question. Here is the timeline we do have based off reporting from NBC News and information from the CDC. December 31st, Chinese officials confirmed cases of pneumonia in Wuhan from an unknown cause. A week later, the outbreak is ID'd as a new strain of coronavirus. Nearly 2 weeks later, the World Health Organization confirms the first cases outside of China in Thailand, Japan, and South Korea. And U.S. health officials confirmed the first confirmed U.S. case in Washington state from a man who traveled home from Wuhan. Days later, screenings for the virus began at Hartsfield-Jackson International Airport, and on March 2nd, the first 2 confirmed cases in Georgia are announced. So the question now, can anything be done to look back and verify if COVID-19 came to Georgia before those confirmed cases on March 2nd? Dr. Jose Cordero, a professor and epidemiologist with UGA, says researchers did just that in Puerto Rico following the Zika outbreak of 2016.
What was done is just look back at the samples of people that were tested for fever and symptoms that were related like to dengue and others that were negative for that, and were tested for Zika. And because of that, we found some in November, but also we went all the way to July and found none.
Cordero says in theory the same could now be done with samples remaining from people who tested negative for the flu or other viruses here in Georgia.